If you're not asked for your details at a pub, bar, cafe or restaurant, please raise the matter with them. And you must also remember to only visit the indoor parts of pubs, cafes and restaurants with your extended household only. You should not gather indoors with other people. Most of us are following the law and helping to stop the virus from spreading. But I'd like to finish by saying this to the small minority of people and businesses who aren't. We will take action to enforce the rules in Wales. Ignoring the legal requirements to minimise the risk of spreading coronavirus on premises cannot be an option. We're working with local authorities, with environmental health officers, with the national park authorities and with the police to ensure that measures to keep us all safe are complied with. We also have enforcement powers, which will allow us, local authorities and the police, to take action if some people's behaviours become a threat to other people's health. Changes to those powers this week will mean that this includes closing premises if it's necessary, and will also act on intelligence reported to the Wales TUC and its affiliated unions. Coronavirus has not gone away. Together, we must do all we can to keep Wales safe. And if we can do so, then we can also keep Wales open and vibrant in the months ahead. Diolch yn fawr. I'm happy to take questions. I'm going to start with James Williams from the BBC.
Can I start by asking about a potential surge, a second surge in cases in the winter? Are you confident that your testing regime and the turnaround of the speed of turnaround testing turnaround is going to be in the right place come the winter? How is that going to be achieved? If you have to, close certain parts of the economy in the winter, will keeping schools open be a priority? And then finally on this, from this week, children under 11 no longer need to socially distance. So are you saying that it's still too dangerous for children over 11 years old not to socially distance? And how does that square with schools reopening in September and with minimal social distancing?
Well, thanks very much, James. I think, first of all, it's worth saying that we have to keep an eye on the situation, and we will be responding to the circumstances as things develop as we go into those winter months. In relation to testing, I think it's worth emphasising that we are not in the same position as they are in England. Across Wales, 84% of people tested at mass testing centres whose samples were processed in Wales and UK labs had their results in 1 day, and 98% of them had their results within 2 days. So we're not in the same place as the United Kingdom, as the rest of England, when it comes to testing, which is why we are more confident that we are in a position to open schools in September. When it comes to younger children, we have looked at the evidence which suggests that these young children are less likely to suffer from symptoms, and therefore we have changed the rules on that. Of course, we will keep an eye on the situation, but we are putting measures in place within school to make sure that where possible, children comply with the rules that we've set out in that guidance for schools. I fod yn glir, mae rhaid i ni sicrhau ein bod ni'n edrych ar y sefyllfa wrth i bod hi'n datblygu mewn i'r misoedd yn yr Hydref a'r Gaeaf. Os ydych chi'n edrych ar sefyllfa o ran profi, ni mewn sefyllfa holl wahanol i'r hyn chi'n gweld yn Lloegr. Yng Nghymru, o 84% o pobl oedd wedi cael eu profion, oedd 84% wedi cael eu atebio nôl o fewn diwrnod, a 98% wedi cael eu atebio nôl o fewn deuddydd. Felly mae hwnna yn sefyllfa sy'n wahanol i Loegr, a dyna pam ni'n fwy hyderus ein bod ni yn gallu agor yn ysgolion ni ym mis Medi. I ni di edrych ar y dystiolaeth sy'n dangos bod plant o dan 11 yn llai llai debygol o pasio'r feirws ymlaen. A dyna pam i ni'n gweud bod hi'n bosibl i ni rhyddhau rhai o'r cyfyngiadau yn y maes yna, ond wrth gwrs mae yna guidance arall mewn lle ar gyfer yr oedran sy'n hun.
And keeping schools open is going to be a priority over other things if things need to be closed down again?
I think if you look at our priorities, then certainly looking at keeping schools open is something that we feel is really important for the future and of course will be absolutely in the priority list of what we want to keep open.
Okay, and secondly, were you aware of the UK government's call for pharmaceutical companies to have 6 weeks worth of drug stockpiled for the end of the transition period at the end of the year? Where do you as the Welsh Government stand on this? Are you sort of across those discussions? Are you urging and doing any of your own stockpiling, particularly on medical supplies, and sort of how does that fit in with stockpiling for coronavirus pandemic as well?
We've been preparing for a no-deal Brexit for a long time. The stockpiling of drugs is something we have taken seriously, certainly something which we prepared for during the last time we thought we may leave without a deal, and certainly that work is continuing as we approach the December deadline. So that work is continuing and is in hand in Wales. Can I move on now to Owain from ITV Wales?
Can I ask on local lockdowns, are they being considered as an option if things or spikes in some parts of Wales get to a point where you think they're warranted? And can you explain to us a bit about how they would work? Would they work per local authority or would they work per, say, town or city?
Certainly, we haven't closed off the option of local lockdowns. This is something that we're keeping a close eye on. You've obviously been aware that there has been a spike in the Wrexham area. We've looked in detail at what's been happening there. We've done extensive testing. But we have determined that of the 1,418 people who were tested, only 11 were positive, which meant that we didn't feel that we needed to impose a local lockdown in that area. But it is something that we will keep on our agenda and something which we certainly will look at. It will depend on how broad the spread of the virus is. Obviously, we will try and restrict it to as close an area as possible in order to not disrupt the lives of other people. But we will just keep an eye on things, and obviously we will be sending in mobile testing units as we have done in Wrexham if we see those peaks continue.
And the Federation of Small Businesses today writing to you as a government saying that if you do introduce local lockdowns, urging you then to provide support to those businesses that have just reopened who may well need to close again. What kind of support in terms of a business sense would be on offer to communities who would have to lock down again?
Well, we have already given considerable funding and support to businesses across Wales. We are in the process of developing the third phase now of the resilience package that was set up, and that is something that could be considered within that third phase that we're talking about, if we were to see that situation arising. Can I ask Will Hayward, please?
Thank you. Following on from what James said about a winter spike, you must have already done the modelling ahead of a winter second wave. Can we have the figures for what will be needed in terms of PPE, ICU capacity and testing if there is both a large rise in flu and coronavirus? And does Wales have that?
Well, we have been preparing very intensively for a winter spike. In fact, lots of the work of government at the moment is gearing up for that very situation. In terms of PPE, we're very confident that we're on the right track with that and that we will be able to meet any surge that happens as a result of that. Testing, we're in a situation where now we have testing capacity of 15,000. Obviously, if we see a huge surge, then that will also have to be increased, and we are developing the capacity for that as well. So we do feel like we are preparing, the hospitals are preparing, the health board stores are preparing, and we do feel like we are have things in hand. And of course, we are not closing down all of the field hospitals that we opened as well, that were ready for that first peak.
Just following on from that, are we able to, I appreciate you might not have them to hand now, but would the Welsh Government be able to issue what those figures are for what is going to be required in terms of PPE, ICU capacity and testing? That would be really useful. And can I also ask about enforcement? We saw some unsavoury scenes in Cardiff Bay and St Mary Street with large mass gatherings with no social distancing. You said in your speech that you would take action. Exactly what is the Welsh Government going to do to prevent those sort of incidents happening again? And just following on from that, whose job is it to enforce face coverings on public transport?
So we've just, first of all, on the situation where we're trying to close if premises that will not comply, we are developing and will be have the powers this week to take reasonable measures against those premises that are not really complying with the guidance that we have set out. Local authorities will have the powers to, first of all, issue a premises improvement notice, and if that is not complied with, then they will be able to issue a closure notice against those organisations that are not complying with those recommendations. So those are our stronger powers than have been there in the past, and I think people should be in absolutely no doubt at all that we will use these enforcement measures if people do not comply. This is about keeping the country safe, keeping the public safe, but we all have a responsibility to make sure we behave.
Sorry, I wasn't asking about premises. It was more around in public areas like we saw in Cardiff Bay and on St Mary Street, not necessarily the premises, but people gathering outside. And if I could just get a follow-up on whose job it is to enforce face coverings on public transport?
Okay, so on the situation with the public complying with the rules outside of facilities, then it will be the police's responsibility to make sure that people comply with the rules. 2 metre law is indeed something that is enforceable in Wales, and the job of enforcing the masks on public transport is something that is a responsibility both of the transport and also of the police. Can I ask Dan Bevan if he has any questions?
Thank you, Ms. Pearson. I refer back to your opening statement on events outdoors. I'm sure the industry have been asking you the questions about when they might be able to reopen this month, next month, or giving a sign on the new year. What have you been telling us?
Well, large public events are something that we will not be considering opening in the near future. We are very clear that if we have huge gatherings, that could provide a situation where the virus could spread. And therefore, we are in close contact with the events industry to see what we can do and what we can open in a measured way. Of course, now 30 people are able to gather outside, so that may be an indication of the way things may be able to open in future in the events industry. But we have got to keep an eye on these things. The last thing we want to do is to open things up and then see them close down again. I think that would be more disruptive than anything else.
Thank you. And referring back to what Will was talking about, the things in Cardiff Bay, just a stone's throw away from the Senate. What do you feel when you see people so flagrantly flagging the mass gatherings?
It is a really concerning situation. It is something where I think we do have to get messages out, in particular to younger people, that this does affect them, it will affect them, and is clearly the evidence suggests that the younger people are really perhaps in some parts of the country not taking this as seriously as some of the other age groups. So that is a message that we need to get out, but the police are very well aware of the situation in Cardiff Bay and will be enforcing measures to make sure that people comply with the rules.
How do you do that? How do you engage with the younger audience in order to make sure that they understand that the laws apply to them as well?
Well, there, of course, are many means of communication now, and we can use social media, and we'll be doing that in the future to make sure that those younger people understand the message and that it applies to them as well. Can I ask Steve Bagnall now, please?
Good afternoon, Minister. The Wrexham Minor Hospital still has around just under 60 cases of coronavirus. Health chiefs have insisted they don't need to use the Deeside Rainbow Hospital and cope effectively. But one suggestion we've heard is that maybe there isn't the staff to man these field hospitals at the moment. What would you say to that, and at what point would they be brought into use?
Well, we're not in a situation yet where we need to use the field hospitals in that area, but of course we are keeping an eye on the situation. The rules in terms of restricting the spread of coronavirus in hospitals are very clearly set out. We know that Wrexham Minor Hospital is making every effort to comply with those rules, and of course we will make every effort to try and restrict the spread in Wrexham Minor Hospital. I think it's probably also worth saying that there has been an increase in terms of testing in Wrexham. There have been 2 mobile testing units, one in Kaya Park and one in Hightown, where people have been tested. So we are keeping a very close eye on the situation in Wrexham Minor Hospital, but at the moment there is no need to use those field hospitals.
Thank you, Minister. And North Wales Tourism has expressed concern that 12,500 jobs in the sector could be at risk due to reopening in August. If people do lose their jobs as a result, will there be support measures in place to help them?
Well, we have already given significant support to the tourism sector. Of course, we are also aware that this is the time of year when they make their money and are able to therefore live throughout the winter. We, of course, have always had an emphasis on trying to encourage people to extend the season in Wales, to make sure people come to visit Wales outside of the season. We will have to keep an eye on what's happening with the pandemic to see if that is something that we can continue to encourage. But we are delighted that we have now more or less opened the tourism industry completely, and it is really heartening to see so many people coming to enjoy our fantastic scenery in Wales. Certainly, I've been in St David's for the past couple of weeks and it is absolutely packed. But people are, I think, generally respecting the rules and understanding that they have a responsibility when they come to visit Wales, when they come to visit some of our tourism areas, that they have a responsibility to comply with the rules to make sure that we don't see that spread that we've seen in other parts of the country. Rob Taylor, Wrexham.com.
Good afternoon, Minister. The local health board have said routine screening is not in place for staff, as Public Health Wales guidance states staff is to be tested when they show symptoms of COVID-19. It's been claimed that NHS staff who've been working on COVID wards in Wrexham were not tested before returning to non-COVID wards. Is that something you can give clarity over? And do you personally believe NHS staff working on, or who have recently worked on such wards, should have regular tests?
Well, anybody who works in a hospital, and certainly people who are moving from one part of the hospital to another, will have to comply with the rules that have been set up by the health board. And that means that they have to comply with the rules on PPE, which means that they would have to completely change their PPE protection if they were moving from one part of the hospital to another. So I think those measures are in place. And certainly, as I say, there has been an increase in testing in the Wrexham area.
Thank you. I did ask for your personal opinion there, if there should be staff testing in that particular situation. Moving on, a local health board update a week ago referred to one COVID-19 positive patient being discharged. On Friday, the First Minister said action would be taken if rules were not followed, and referred to people whose behaviour, to quote him, said became a threat to other people's health. And earlier you gave firm warnings to businesses saying that action would be taken to enforce the rules. Do these Welsh Government warnings also cover health boards who discharge people into the community with COVID?
Certainly, we would take a very dim view of health boards who would not be ensuring that people, when they are released, are not, that it is important that they are not carrying the virus. And therefore, yes, we would take a very dim view on health boards that don't comply with that. Can I ask Andrew Nuttall now from the Leader, please?
Thank you, Minister. With regards to sort of staycations here in North Wales, we saw a large volume of traffic on our roads in Flintshire on the Friday just gone, heading through to our sort of northwest coastal spots, which are prominent tourist areas. So as more and more of UK residents
One of the things that we were very careful about when it came to reopening is to make sure that we did develop the support of the local communities, which of course are to a large extent dependent on the tourism sector for their livelihoods. So it is important that we continue to welcome our visitors to Wales. We have to ensure that we continue that Welsh warm welcome that people have become used to. And of course, if we do see any incidents, we will expect those visitors to report that they are feeling unwell, that they report and participate in the test track and trace process. And of course, when we see those incidents arising, we will lock down very hard on those instances and try and put a ring of steel around those areas so that we don't see the spread of the virus in those communities.
Thank you. And obviously it's been touched on already by some of my other press colleagues with the Wrexham Mile Hospital. Currently we're seeing sort of a second spike in cases here in Wrexham. Firstly, we had one linked to the Rowan Foods factory, and now there's obviously community concerns about the Mile Hospital. Latest figures from Public Health Wales have showed us that there were 42 hospital-acquired cases of the virus in North Wales for the week ending July 26th. We understand that the majority of those were at the Mile Hospital. So how confident can people feel about the safety of going to their own hospital here in Wrexham when the virus is so prominent?
Well, we are in constant touch with the Wrexham Mailer Hospital about what measures they're putting in place. Public Health Wales are working with them, along with the Health and Safety Executive, to make sure that that response within the hospital is an adequate response. But I would like to just give comfort to people that we are assured that the hospital is safe and that all measures will be taken to ensure that people cannot catch that virus within the hospital. And finally, Tom Magner.
Thank you very much indeed, Minister. My two questions are against the background of our viewers at care as well, who are unpaid carers and carers struggling with work and care at home. They tell us they're afraid to go out. They accept the First Minister says it's a choice, not an order, when shielding ends, for example, on the 16th of August. But can I just see what you think of these twin reasons for the fear? You referred earlier on to a significant minority who weren't observing the relevant measures. You talk of stronger powers, reasonable measures of social media communication, but it's the ones who aren't engaging. Doesn't that mean that effectively at street level it's almost impossible? And what are you saying to the police about what the threshold should be? Should it be every incident when there's 100 people, 1,000 people? Could you give us a sense of the enforcement situation a bit more detail, please?
Well, certainly, I would reinforce the advice that the First Minister gave when it comes to people who are shielding. It is a choice for those people. At the moment, the incidence of the virus is still relatively low within our communities, so now is the time, if you do want to go out, now is the time to do that before we are expecting a further peak perhaps in the autumn. But of course, when people who have been shielding go out, then they should, of course, take those additional measures to make sure that they protect themselves and do not go into areas where there are too many people. Certainly in terms of the police's approach is generally to engage, to educate, and then to enforce. And that is an approach that they've taken throughout this crisis, and one that we would commend.
And secondly, if I heard you correctly earlier on, you said that young children are less likely to suffer from symptoms. That's the problem, isn't it? The people without symptoms. So what part is symptom-free people playing in your ongoing policy decisions, especially when you see crowds with apparently not a care in the world?
Well, certainly we are trying to encourage people who do display symptoms to report very early, and some of the additional research we've been doing this week looking at people who perhaps have been suffering quite severely from coronavirus, that they don't very often display those symptoms of shortness of breath that we have learnt to expect that people have been told are signs of coronavirus. So we do have to be careful of those people who don't have and demonstrate those symptoms, and make sure that we keep that social distance. The key thing here is to remain socially distant from people, wash our hands regularly, and make sure that we comply with the guidance that has been set out by the government. Diolch yn fawr. I hope that has cleared up some issues today. Diolch yn fawr.
Week.
Yeah, I got the same. It was quite hard to actually pick up what the minister was saying.
Yeah, me too.
Technically, apparently it's fine, but on this it was a bit. Yeah. Yeah.
Okay.
It might just be the three of us talking to each other.
No, I'll pick that up, guys. Sorry. Yeah. We thought we had it fixed this morning, but thanks for feeding that back. I'll have a look into it now to see what might have changed.
I think it's something to the podium because it.
Yeah.
By the laptop there, it was definitely for you, but from there it's just a bit quiet.
Yeah.
Okay, great. So when Minister's speaking, it wasn't as clear as usual.
Yeah.
And you said you were getting sort of feedback, so that would be, we've got a microphone on the TV that you're all coming through, so it wouldn't necessarily be picking that up, it was just picking up sound in the back of the room, perhaps, was it?
Yeah, Mike, now I think it's almost like the microphone is where we're seeing you from, essentially where the camera's located, as opposed to on the podium itself.
Okay.
Externally, it's fine. So
I wonder whether it's taking the audio on the Zoom call is going through the webcam rather than the podium mic. Right.
Oh, that could be it.
Because if anybody behind the camera typed, it was like they were typing in my head. Whereas if the minister spoke, it was he could barely pick it up.
Right. So it was you were coming through the internal mic on my laptop, which definitely shouldn't have been happening. All right. Thank you for pointing that out, guys. I'll fix that now. Cheers. I'll see you next week.
Cheers, mate. Okay, thanks all. Bye.